So welcome to the Spotlight series for the Movement Guild. Today we have Dr. Sugarman with the American Hip Institute. We've personally worked and referred Dr. Sugarman a number of patients for hip and knee issues and had a lot of success with him. And so I am really grateful to have him here today. Dr. Sugarman, thank you very much for being here.
Oh, it's my pleasure. Thanks for having me.
Maybe you could just tell us a little bit about yourself and your practice and go from
Sure.
there.
Yeah, absolutely. So, as you mentioned, Adam, I'm Director of Joint Preservation at the American Hip Institute. We are a group that is primarily dedicated to the treatment and cure of hip problems, almost all ages, 12 up to 120. And our focus is really threefold. It's on the clinical treatment of patients who have sometimes very complex hip problems, sometimes very basic hip problems. That's on the one side. We also have a large portion of our practice and thought process is developed towards our American Hip Institute Research Foundation, where we are a very active research group looking at outcomes of hip surgeries development with an idea towards how do we best help patients, how do we continue to innovate. And we also have an innovation arm where a lot of the treatments that we have employed and currently do employ have actually been invented at American Hip Institute over the last 15 years. So large focus on hip surgery, hip replacements, hip preservation, hip arthroscopy. Myself, I come from a sports medicine background, treating anyone from the weekend warrior, high school athlete, up through professional athletes. Take care of, or I've taken care of a lot of professional teams in the past across a number of sports. And so my particular focus is on joint preservation of the shoulder, hip, and knee, obviously with a focus on hip, but I also do quite a bit of complex knee preservation as well as shoulder surgery.
What made you decide to become a surgeon?
I don't think there was much decision. Truthfully, I always love working with my hands. That was kind of the baseline, and then kind of parlayed that in through medicine as a way to be actively involved in the treatment and care of patients. And I think orthopedics in general, particularly called to me. My grandfather owned a hardware store. I always loved woodworking growing up.
Awesome.
And there's a lot of relationship to that, but also with orthopedics, it's a quite unique, I think, field where you have the ability to really make people better in relatively short order. And it's particularly gratifying, I think more so than most fields.
I agree with you a lot. You said a little bit, you alluded to this, but maybe you could talk a little bit, Doctor, about what makes the American Hip Institute different than some of the other places. I feel like I might be able to answer that even just from my perspective of being a practitioner that's worked with some of your people, but I'd love to hear your
Sure.
thought on that.
Yeah, I think, let me start at the beginning. I think let's say hip replacement is something that is done frequently by many, many people. And there's a lot of innovations that we have done in American Hip Institute. We were among the first, if not the first, maybe first or second in the country to do outpatient hip replacement, robotic hip replacement, anterior robotic hip replacement. Very few centers even now are doing. So there's a lot of innovation on the joint replacement side. And reconstruction, hip resurfacing. On the hip arthroscopy side, which you think of more and more, we're recognizing that, first of all, most people that need hip replacements later in life probably had an underlying hip condition, which may have been able to be treated earlier. Two, hip problems in, let's call it young adults, is a far more common problem than I think we see even in our clinic. And probably if you walk into a random audience, there's going to be a lot of people that have hip problems that don't recognize that they're hip problems. Over the last 20 years, as hip arthroscopy and the understanding of hip pathology in younger people has matured, we have been at the forefront of treatment of that, of treating, of developing techniques to treat it, of evaluating techniques, of trying to perfect techniques, and really advancing the field And as a result of that, have become a destination worldwide for patients that are seeking treatment for hip problems, sometimes as a first foray into it, and many times, unfortunately, as second, third, or even fourth times where they have been treated elsewhere and then have come to us for treatment.
What's the process look like to work with you or your organization, doctor?
Yeah, well, we try to make this as easily accessible to people as possible. As I mentioned, for people that are local, great. For even people from not local, a large portion of our patients come from all over the country, all over the world. And so we have concierge teams that really help shepherd people through the process, making sure that if they have information, prior treatments that have already been done, that's collected in the most efficient way for them. And then when they come in for a visit, we really focus on giving them as much time as possible and as much time as they need to really go through everything as a comprehensive evaluation. And we have a process that we have developed here at American Hip Institute that has steps to help patients understand where they are. Sometimes people come in and everything is done, right? They've had treatments, they've had imaging, they know what they need, and they're here for surgery. That's fine. Many times people don't need surgery, but they need direction or they need further evaluation. And so our job is first to help them understand what the problem is, understand what their options are. If they need injections, further evaluations, whatever the case may be, we can do that. Partnering with their physical therapists to really make sure that they have a comprehensive approach to their treatment plan.
I've observed you do a really good job of that, working and teaching your patients and educating them on what's going to happen. But also, I was very impressed with a number of my patients that I've worked with that have come from your group have had PT, they had PT with you and they got started rather than, and I've seen, and then they came to us after a week or two of being with you just for convenience or whatnot. But I was very impressed with just the PT that they were getting, which from some of the PT that I've seen of other people that have had hip pain and post-surgery, like hip issues acutely have had. So I just wanted to give you props for that. Good job there.
Thank you very much. I mean, listen, we try very hard and we recognize that it's not convenient for many people to continue to come to us for physical therapy. Obviously, we offer physical therapy for those that want, but it's also important to have an ongoing relationship with our physical therapists and other physical therapists around the area, around the state, around the country, in an effort to really help patients wherever they're coming from.
Doctor, I don't want to take up too much more of your time. What is the main thing you'd like to be known for? What are you best at?
Well, I would say that there are options for people. And so what am I best at? I love doing preservation surgery, hip and knee, as well as shoulder. Obviously, we specialize in hip arthroscopy here and hip preservation surgery. But I think what I see a lot of times is people that are coming in that feel like they have pain and they just have to live with it, right? Or they have dysfunction, they just have to live with it. And that's really not the case. And I think that there's a lot of opportunity to help people. And sometimes that's surgical, and sometimes it's not surgical. And if we can keep people healthy and get them better without surgery, I think that's ideal. And if they need it, then, we obviously have solutions for that as well.
Great. Is there anything you want to finish up with? Tell us anything special you want us to know about, or anything for the last, besides where we can find you. Obviously, we'll link that into the conversation here.
Yeah, no, I mean, I think we're always available for people. We have a lot of education that we try to put out on social media as well. So if people are looking, but I think the parting statement is, you don't have to live with pain. And pain, let me put it this way: pain as a 30 and 40-year-old sitting or driving is not a normal thing. I can't tell you how many times I
Absolutely.
see people who are like, yeah, I have pain whenever I sit. That's not normal. It's common.
Yes.
It's not normal and it is treatable.
Completely agree with you, sir. I appreciate your time today. I truly enjoy working with you and your group. So thank you so much for that.
Well, likewise, and thanks for having me. It's really always a great opportunity to talk. So thank you again.
My pleasure. Thanks. Thank you.